This was a child that it would hurt to even set up, and it would hurt to run and laugh.
My belly, every time I got up, it hurted right here.
Connor presented with inflammation throughout all of his large intestine. His working diagnosis was ulcerative colitis.
After 2.5, he started having issues. He was just having diarrhea every hour. It was like the toughest time of my life.
He was on IV steroids and ended up with fairly chronic steroid exposure. There were two things, really. It's the fact that he developed this disease at such a young age. That's a big red flag. And the fact that it was very difficult to control. The earlier the onset of the disease, the much more likely we're going to find something with genetic testing. So really in all children under the age of 6, we start genetic testing as soon as we meet them. Many of those patients have other diseases, often caused by a single gene.
My grandmother said, wait a minute, I had the same issues.
She had issues all her life.
She said, you know, you really need to take you to Mayo. The Mayo, they've always been known to be able to review these types of matters and be able to help provide a solution.
Whenever we do whole exome sequencing, we prefer to do trio testing. So in my case, it's my patient and both parents. There's a whole team that reviews this. Genetics and bioinformatics folks who can look at this raw data.
What they did find out, which was a revelation for me, was that Connor and I both shared a mutated gene called the Lynch syndrome. Went in for a colonoscopy, and they ended up finding a couple polyps that were removed.
And you never would have got a colonoscopy.
No. Now that there's just more awareness, and now I'm being tested more frequently.
Before we knew that Connor had this genetic variant, we worked very hard to try to get his colon to heal. We knew that his colon was making him very sick, and he was at a high risk of developing cancer in his colon later in life. And so I think it just became clear that his colon needed to come out.
That I knew that everything was going to be okay like a month after the surgery. It's like everything started turning around.
Just a happy little boy that he was meant to be.
Just like we have our child back.